Hello, welcome to this month's Fit for Colorado Talk to the Doc chat. I'm CBS 4 anchor and health reporter Kathy Walsh. For the next half hour, we'll be chatting about fitness and health issues here on CBS4Denver.com. It's something we're doing on the first Tuesday of every month at 11 a.m. Throughout the chat, we encourage you to ask questions by simply typing them in the chat window at right, and we will do our best to answer those questions. In today's chat, we're going to discuss type 2 diabetes, the most common form of diabetes. It was once called adult onset diabetes, a metabolic disorder primarily characterized by insulin resistance, meaning your body is not able to keep your blood sugar level at a healthy balance. More than 20 million Americans have type 2 diabetes. It is rapidly increasing, enough to have the CDC characterize the increase as an epidemic. It is also now being seen in children and adolescents, and some believe that is linked to the rising rates of obesity in this age group. Joining me today is Dr. Margaret Eagan, a specialist in endocrinology and metabolism. She is with Rose Medical Center. And also Kim Gorman, Weight Management Program Director of the Center for Human Nutrition, UC Denver. All right, Dr. Eagan, you heard my explanation. How do you explain type 2 diabetes?
As you said, Kathy, type 2 diabetes is a problem with blood sugar in the vessels. What happens is people have inherited a genetic predisposition to type 2 diabetes. If you have a parent that has diabetes, you actually have a 50% chance of having inherited the gene. And so therefore, if someone comes in with a family history like that, then I would recommend that they do get screened for type 2 diabetes, or if they have the pre-diabetes, meaning have they inherited the gene.
Right. So is it always genetic?
No, 50% of the time it's genetic.
Okay.
The other, 90% of the time type 2 diabetes is genetic, but then obesity, as you were saying earlier, becoming an epidemic, that's why we're seeing a lot of more and more type 2 diabetes.
All right, let's talk about why is it so serious, and I know that you gave us a slide that has some great information on it. I believe it's slide number 1, called Living Well. Tell me about this. Why is type 2 diabetes so serious?
The reason it's so serious is it attacks every single organ in your body. We basically have no cure for it.
Wow.
So once someone is diagnosed with that, it's changes in lifestyle and exercise. And as I said, it attacks every organ, meaning it's the most preventable cause of blindness in the United States.
Wow. And tell me about some of the other things. I mean, my understanding is heart attack, stroke. I know people who've lost digits, lost fingers, lost toes.
Correct. Heart disease is also a major killer of people with diabetes. Even when their blood sugars are under control, they still have a much higher risk of heart disease than the average person. And that's another reason to get them in the pre-diabetes stage, because that heart disease risk doesn't start right when the diagnosis of diabetes starts. It starts earlier in their life.
So it can be fatal?
Yes.
Wow. Okay. You talked about it being 90% genetic, but why do people develop it?
As they get older, the most common reason for people to all of a sudden present with high blood sugars is the obesity. It's insulin resistance. The body is overproducing insulin their entire life in order to maintain a blood sugar that's normal. But eventually the pancreas gives out and says, I just can't keep up with this anymore. And that's when the blood sugar starts to rise, and that's when they're diagnosed with type 2 diabetes.
So what are the symptoms? How would you know that you might have it?
Very subtle symptoms to begin with are just chronic fatigue, which when you talk to most people, they have fatigue.
Right.
Getting up in the middle of the night to urinate, going a lot more during the day. Again, that's hard to understand because in Colorado we're all dry, we're all telling people to increase their water intake, and so they're increasing the water intake, but then they're also increasing urination. Other symptoms would be abdominal weight gain, that all of a sudden people start to put on weight. They haven't changed anything in their lifestyle. Their exercise pattern is the same, their diet is the same, but then all of a sudden weight starts coming on and they can't explain why.
And we talk so much about obesity and type 2 diabetes. I know, Kim, that you've got a graphic for us that obesity and diabetes. Let's take a look at that. Can you explain this for us?
You know, pretty interesting. 65 million struggling with obesity in this country. And that obesity meaning it's a BMI or a body mass index 30 or greater. But if you look at the diabetes, the 23.5 million with diabetes, 55% of that group lands in an obesity category. 85% of those folks land in an overweight or obese category, which is a BMI or body mass index greater than 25. So that's a big hunk of those people that are landing with they're just not at a healthy body weight.
Wow, there's a lot of people, as we've talked about. So how important is diet, and what do you suggest?
Well, definitely, we're talking about trying to reduce body weight, and I think if we can get 5 to 7%, somewhere between 5 and 10% of the original body weight off, we're going to see improved lipids, we see improved blood sugar, we see improved hypertension, their blood pressure improves. So we're really aiming at kind of a small amount of weight to get reduced. So that's somebody who is at 200 pounds right now. You're talking 15 to 20 pounds of what we're trying to pull off and sustain that weight loss.
Okay, and also being active. I know you're a strong proponent of being active. Explain this, the top 5 benefits of being active.
Yes, I love the first, improve your blood glucose management. You have glucose floating around in your blood because that's what your organs need, your body needs, your brain needs to have energy. So when you start moving, you're going to burn up some of that glucose. In addition, when you're physically active, your cells become more sensitive to the insulin that your body is producing. So it'll also help manage that blood sugar. We're seeing, of course, when you increase your cardiac capacity, the strength of your heart muscle, we're going to get an improvement with the blood pressure. So that's number 2 on there. And then, of course, improve the blood fats. When you're physically active, you're going to see an elevation of the HDL cholesterol. I call it the happy stuff. It's the good stuff. That's going to help ward off some of that heart disease. It'll also reduce the LDL, or the lousy cholesterol, the bad stuff. The medication. If you reduce your body weight, if you're using some of the glucose that's circulating, if your body is more sensitive to the insulin usage that it's producing, you're going to see a decrease in the insulin or the diabetes medication that you're taking. And then lastly, number 5 on there is lose the weight and keep it off. We know, watching the National Weight Control Registry, that folks who have been able to maintain a significant amount of weight loss, it's through physical activity. So if you have physical activity ramping up in your lifestyle and you're losing 10, 15, 20 pounds, the likelihood that you'll be able to maintain that weight loss with physical activity is much greater.
Absolutely. That's the thing we always know. It's sometimes hard to process that up here because you've got to get that in your mind and stick with it.